Good afternoon. My name is Peggy Rauman, and I am a nursing consultant, policy and practice here at the College of Registered Nurses of Newfoundland and Labrador. I'm delighted to present to you today an overview of our newest document entitled Virtual Nursing Practice, VNP 2020. This document was approved by CRNNL Council on June 5, 2020. CRNNL has been tracking and trending providing nursing services through a virtual means for many years. Sometimes virtual care has been the desired option or the only option, especially for those who live in rural and remote areas where face-to-face visits are not always available. The COVID-19 pandemic and the subsequent social distancing protocols has further highlighted the unprecedented need for the use of virtual care technologies to deliver nursing services safely. CRNNL's mission to advance nursing excellence for public protection and optimum health of the Newfoundland and Labrador population. We do this by articulating the professional expectations for registered nurses and nurse practitioners, and in this case with respect to engaging in virtual nursing practice. It is linked with our strategic outcome 2, accountable professionals, where registered nurses have access to resources to support professional practice and engage in self-regulation. As registrants with the CRNNL, RNs and NPs who engage in virtual nursing practice must comply with regulatory requirements as outlined in the most current version of the Standards of Practice for Registered Nurses and Nurse Practitioners, the Code of Ethics for Registered Nurses, all applicable legislation, including any duty to report, such as within the Public Health Protection and Promotion Act and the Personal Health Information Act, and in accordance with relevant documents, such as the Scope of Practice for Registered Nurses and Nurse Practitioners, and any business or employer policies. Virtual nursing practice must be delivered in a manner that is in the best interest of the public, ensuring the delivery of safe, competent, compassionate, and ethical nursing services. The purpose of this document was to articulate the practice expectations required of registered nurses and nurse practitioners when providing nursing care and services through a virtual platform. Virtual nursing practice encompasses all types of nursing care and services that are delivered across distances via the use of virtual care technologies, and that will be in our next slide. This document does not provide information on licensure requirements, and RNs and NPs are encouraged to connect with the CRNNL registration to address license questions and concerns. So just some definitions. The virtual care refers to any interaction between the client and or members of their circle of care occurring remotely using any form of communication or information technology. And the aim is to facilitate or maximize the quality and effectiveness of client care. That was from the CMA 2018. Virtual care technologies are those forms of technology that allow virtual interaction with healthcare professionals to occur in real time from virtually any location. Services provided using virtual care technologies range from simple to complex. And then with those two definitions, virtual nursing practice, like I stated in the previous slide, encompasses all types of nursing care and services that are delivered across distances via the use of virtual care technologies. So nursing care and services may include, but they're not limited to, you can provide education, nursing counseling, assessment, initiation, and evaluation of a treatment plan or healthcare monitoring, among others. Examples of simple technologies, the simple to complex. Simple technologies may include the telephone, text, messenger, or email. Examples of complex technologies include, but are not limited to, live two-way audio video conferencing or virtual visits. And then there's extremely complex with like teleradiology or telerobotics or remote control, surgical instrumentation. So there's many different things. And when we are talking about technologies such as telephone, text, and messenger, we'll get into this later, but you have to have employer support to to use these technologies. So this diagram here is just a representation of what the virtual nursing practice document encompasses, and it's just a quick reference for you to be able just to say, I have to look at 3 things: the appropriate duty of care, my appropriate technology, and appropriate employment support. And if I have all of those 3 things, then yes, virtual nursing practice might be appropriate for care. So as nursing is a reflective practice, registered nurses and nurse practitioners need to reflect on their virtual nursing practice, the context in which they are providing their services, their patient population, your employment context, and your individual competence to ensure that you're not unknowingly taking risks with clients. Registered nurses and nurse practitioners must be aware of the risks of providing nursing services through a virtual platform and have a process in place to reduce or mitigate the risks. And to help reduce risks to the public, when engaging in virtual nursing practice, RNs and NPs reflect on the appropriateness of this method to deliver nursing services. And it is in respect to, so you're looking at the appropriateness of virtual nursing practice with respect to the appropriate duty of care, the appropriate technology, and appropriate employment support. And none of this is new information. This document is just used as a means to get you to think about all the different aspects that are involved with virtual nursing practice, such as using the nursing process, maintaining your standards of practice, while providing your nursing services in this relatively new platform. As within all practice environments and employment situations, the appropriateness of duty of care being provided is specific to the client, the provider, the type of care practice, the location, and the availability of supports. When engaging in virtual nursing practice, a formal duty of care is established between the RN or NP and the client the moment that the RN or NP answers a phone call, a text, or a message, or an email, or any other means of communication technology to provide nursing services or advice. Like we said in the previous slide, it could be education, it could be counseling, it could be a nursing service. Therefore, RNs and NPs who have established a formal duty of care with clients are responsible and accountable for the care that they are providing. However, with virtual nursing practice, because the client is in a different location, the nurse's ability to do a comprehensive face-to-face or hands-on assessment if needed is reduced, and therefore virtual nursing practice may not be appropriate in all situations. And this is where your professional judgment comes into play. So if you know that you cannot provide nursing services or provide the right advice or implement the right type of nursing care, then your appropriate virtual nursing practice might not be the most appropriate duty of care, because you cannot do that hands-on or face-to-face assessment. Therefore, when reflecting on the appropriateness of care, you must consider the use of the nursing process. Virtual nursing practice should mimic the comprehensive care that you would be providing if you were face-to-face. So like I said, this isn't a comprehensive list. This presentation doesn't give you a comprehensive list of or the details that are in the document. It's just an overview. But some things that you need to reflect on is your professional accountabilities and your individual level of competence. How are you going to maintain a client-centered approach? How are you going to obtain informed consent? And with informed consent, especially within the virtual platform, you have to outline the risks and benefits not only of the care being provided, if there are any, but also the risk and benefits of providing care virtually. So a risk for providing care virtually would be, there might be a technology failure and you might not be able to follow up. But hopefully there would be a process to mitigate such a risk. Some other things that you should reflect on is how you're going to use your nursing process. How are you going to plan, assess, implement, and then evaluate the care you provide? How are you going to document? And when we get into the next section, with appropriate employer support and appropriate technology. We will talk about documentation a little further. But in the nursing process, how are you going to, or with documentation in the nursing process, how are you going to write down how you came to your conclusions of your assessment? And you have to use your professional judgment. You all know the nursing process. You all know what needs to be done. You all know what your standards of practice are. But you need to reflect on and use your professional judgment to think about what happens next in this platform. What happens if I do need to do a face-to-face assessment, or if I need to do a hands-on assessment? I can't do it virtually. How do I follow through with the patient? Who do I refer them to? How do they contact the people? If they're in a rural, remote location, how do they get them out if it's necessary? You need to think about third-party assistance. So the third-party assistant could be a person facilitating you with the hands-on portion of the assessment, such as you can have somebody there to remove a dressing so that you can assess the wound or correctly place a virtual stethoscope. Or a third party could be somebody who's deemed competent and authorized within their own scope of practice and employment situation to complete the physical assessment, so that their findings, you can rely on their findings and integrate their findings into your own clinical judgment. But there are things that you need to have, you need to think about and use your professional decision making for. So how do you ensure continuity of care? How do you ensure follow-up? In the employment situation, you might be using decision-making tools or algorithms, but there should be policies and processes in place to ensure that there's continuity of care over time and that there's a way to plan for future visits. Consistency between clients for the same thing. You can have the same algorithm to ensure that that there's consistency. Continuity of care over time has to be thought of. You have to consider the availability of imaging and laboratory and pharmaceutical services and their acceptance of virtual prescriptions, orders, and other healthcare instructions. So it's not just that you can refer a patient on using virtual care technologies, it's that they have to have access to those resources, and you need to consider that when you're thinking about the appropriate duty of care. There's some other questions, like what about web-based or non-client specific advice and things like lifestyle coaching? So RNs and NPs who provide generalized web-based non-client specific advice, such as an RN who writes a blog on lifestyle coaching, they're not considered to be entering a formal duty of care because they don't have any direct contact. They don't know the individual's name. The individuals seeking those services are responsible to use their own discretion when acting on or using the information provided. However, if you are doing web-based or non-client specific advice and you're holding yourself out as an RN and NP and using your services to claim nursing practice hours, you are still responsible and accountable for making accurate, evidence-informed statements that fall within your own individual scope of practice and that are consistent with your standards of practice and code of ethics, and any other of the professional accountabilities that for using the title of RN and NP. In addition, the detail in documentation may vary upon whether you're providing nursing care or advice versus providing nursing information only. The next portion to consider when using virtual nursing practice or when engaging in virtual nursing practice is the appropriate technology. The form of technology being used needs to be consistent with the level of assessment and services required. For example, if you received a phone call from a client and they were reporting respiratory symptoms, you may not be able to gather all the necessary information you need over the telephone. And a physical assessment or a respiratory assessment may be required. So you could complete this assessment by using a third party to help you do the assessment, and then you can use your professional judgment if you have enough information. Or you can use a complex technology such as a virtual stethoscope. But you need to use your professional judgment to see if the level of assessment required is consistent with the level of technology being used. The other thing is, measures must be in place to reduce the risk, and it's an increased risk for breaches of privacy and confidentiality when you're providing nursing services virtually. For example, you have to have a dedicated computer, a dedicated workspace, or a dedicated phone line so that you reduce the risk of hacker intrusions. You also have to maintain ethical and legal requirements for confidentiality of electronic information. And so if you're providing information by email, then there should be the encryption of data. It should be a dedicated environment with COVID quarantine protocols and social distancing. A lot of people are working from home, but the computer that you're using at home should only be accessed by you, and it should be secure. There should be a secure room within your home or your office where that your conversations cannot be overheard. RNs and NPs also must keep up to date on new processes, the equipment that's used in your virtual nursing practice, and or changes in your modality of care. So it's the maintaining of continuing competence. It's just like maintaining your continuing competence throughout the year, but now you may have to include new processes that you're using, new equipment, like maintaining your competence on using the two-way video conferencing or the virtual stethoscopes. And ongoing education is usually required after the initial orientation or education is completed, if you had a lengthy absence from using virtual nursing practice, or there has been a request for a refresher from the vendor or the employer as required. And this is just some of the things that are mentioned in the document for you to reflect on. The next portion of the Venn diagram for you to reflect on is the appropriate employment support. So this document refers to an employer or an employee. So you could be working within a regional health authority who would be the employer and you would be the employee. You could be an independent contractor, so you could be working for another company, but you are still, you're working on a contract, or you can be in self-employment. So if you are in self-employment or if you're an independent contractor, you do have to have policies and procedures to support your virtual nursing practice in place. And you do have to consider the appropriate use of technology, the appropriate duty of care, because you are the employer and you have to have your proper employer support. So some of the things to reflect on is your availability of policies and procedures. So what do you do if this happens? How are you going to do a certain procedure? You have to think about your physical space that you're in. And that it's appropriate to maintain privacy and confidentiality. A process that you might need is what to do to manage if technology fails. So if you're in the middle of a virtual call and something happens and the technology goes down, how do you connect with your client? What do you do next? How do you document that? There needs to be policies and procedures in place to ensure that you're using proper patient identification. How do you, using a virtual platform, ensure that you are providing care to the proper patient and that you know who you're providing care to? How do you ensure that you're getting informed consent? And when I talked about informed consent earlier, it was informed consent with respect to the use of virtual care and the care that you're providing. How are you going to disclose limitations and risks of virtual nursing practice? There needs to be adequate infrastructure for collaboration and consultation, and these all work together, these buckets that you have to consider. So when we were talking about adequate infrastructure for collaboration and consultation, that's with your appropriate duty of care. What happens if I have to refer this patient somewhere else, or I have to have some diagnostic services? Is the pharmacy going to accept a virtual prescription? So there needs to be policies and procedures and adequate infrastructure and support for those things. And how do you adhere to different types of legislations, like your duty to report and FIA? And I just have a note there too, because a lot of people don't realize that as an independent contractor or a self-employed nurse, you may be, if you are holding on to the patient's record, you may be required to meet the custodial requirements in the Personal Health and Information Act, because you are the custodian of the patient record. It's not your employer, because you are the employer. So it's really important to look those things up. So with respect to employment situation, make sure that there's something written down that this is how we do it. Think about all the risks, how to provide the appropriate duty of care, how to making sure that you have the appropriate technology, and that there's policies and procedures for you to follow, that the nursing process is being followed, that documentation is being followed. In the back of the virtual nursing practice document, there is just some things for you to consider when reflecting on documenting care. So when you're using virtual nursing practice, what does your employer say? What does your employer policy say about appropriate documentation? What do you need to record? How do you need to record proper patient identification? How do you need to record informed consent? How do you record or document what nursing care you provided and how you did your assessment? So it will be different in different settings, but documentation is not separate from care. So you have to, consult with your employer and have processes put into place to ensure that your documentation standards are being upheld. Anybody who's participating in virtual nursing practice is encouraged to connect with the Canadian Nurses Protective Society to ensure that you have appropriate liability protection for this type of practice. They have a webinar on telepractice, and they do have some very good documents on the CNPS website. In addition to consulting with CNPS, CRNNL has a number of documents that can be used as additional resources. So self-employment is one that I would encourage you to read, and the documentation would be a document that I would encourage you to read. And they are all available on the CRNNL website. So in saying that, in conclusion, if you have the appropriate duty of care, you reflect on the appropriate duty of care, you reflect on that you have the appropriate technology, and you reflect on that you have the appropriate employer support, virtual nursing practice may be something that you can engage in. And it would be an excellent way to help the Newfoundland and Labrador population access healthcare services. So if